Welcome back to Tuesdays with Timeless. As you know, I'm very interested in the balance of the face, which is one of the things we lose in an aging face, but one of the things that we can restore. If you have watched any of my videos on neuromodulators or fillers, one of the things I aim to achieve is to regain balance. But what happens as we get nasolabial folds or marionette lines or creases at the corners of the mouth, or we lose our jawline and get jowls? Well, now we have PDO threads. And PDO threads are a non-surgical way of placing threads under the skin along vectors that we determine are going to lift areas of the skin that have mild to moderate sagging. So how do we do this? Well, first, I do a history and physical on patients to make sure that they don't have any contraindications and to make sure that they're good candidates. Who's a good candidate? I want them to have good skin. If the skin is too thin, then they're really not a good candidate. And if the sagging is too heavy, then they're really no longer good candidates for PDO threads, and they're better surgical candidates. So ideally, I want someone that still has some turgor to their skin and has mild to moderate sagging in the nasolabial folds, in the corners of the mouth, in the marionette lines, or along the jowls. And once I've determined that they have no contraindications, then I counsel them about the procedure, and I put them on a 2-week anti-bruising protocol. There's a lot of tunneling under the skin, and this can cause bruising. And so by going this holistic route, we have cut down on the bruising quite significantly. Then we schedule the patients for the procedure. They come in that day, and we cleanse the skin, and we mark it. And we do the procedure under Pronox, which is like the nitrous oxide that you have probably heard about done in dentists' offices. Nitrous oxide has 2 effects. One, it provides analgesia, so it allows the procedure to be done with minimal discomfort. Secondly, it also takes away anxiety. When we are anxious, we tense up our muscles, and that releases pain mediators, so it can make discomfort worse. So by relieving anxiety, we don't exacerbate discomfort, and we also offer analgesia, which takes away the pain. So it really makes the procedure not a big deal at all. Then I make tiny 18 gauge holes with an 18 gauge needle in those places where I'm going to insert the needle, having marked out where my vectors are. And I put in hypodermic needles that are preloaded with this very sticky polydiaxanone PDO thread, which is the lifting thread. It's got a little tail sticking out of the opposite end. So I thread it through, and I get to the point of lift, whether it be in the nasolabial fold or at the corner of the mouth or in the marionette line or down at the jowl. And because that tail is sticking out and that tail is sticky, when I tip it there, it'll catch on the skin and it will stick. And then I start to withdraw the needle, but the thread sticks because that tail stuck. Now, as I withdraw the needle, that exposes this sticky thread underneath, and I lift the skin over that sticky thread. And what that does is it sticks the skin to that thread, and then I withdraw the needle. And the effect is that the skin is lifted and it sticks on that sticky thread. It's elegant in its simplicity. It usually takes multiple threads and multiple vectors to get the lift that we want, and it lasts for 12 to 18 months. Now, if a company says 12 to 18 months, it's in my personality to say, plan for the worst, hope for the best. So we count on 12, And if you get more than 12, then that's the frosting on the cake. As I said before, this is ideal for nasolabial folds, the corners of the mouth, marionette lines, and jowls. What are the results? Well, you have immediate lifting because the skin is lifted on those sticky threads. But you also have a longer term effect. The body absorbs those absorbable sutures, but not as quickly as it does when they're being used for surgery, because they've been modified to have those cogs added. As the skin absorbs these modified sutures, it replaces them with new collagen and elastin. So the skin is actually being improved. So this is a non-surgical technique to get a smooth lift to the skin, leaving the face with a natural, relaxed appearance with a more youthful contour. Seems like a win-win. Now, I will often combine this with cheek filler because although this lifts the skin, it doesn't replace lost volume. And part of aging is that we lose volume, especially here in the mid-face. And that often leaves us with sort of a drawn, tired appearance. And if you add just a little bit of cheek filler, then we frame the eyes and we have that additional sort of youthful contour there. So I hope I've answered some questions about PDO thread lifts. If you have any questions, comment below. Have a great week. Stay well, and I'll talk to you again next week.